Hi, good afternoon, everybody. Thank you so much for making the time to join us today. My name is Sandra Caravel. I am the National Programs Manager for LULAC. I am based out of El Paso, Texas. And again, we're going to be hosting our council training for our pop-up events that are going to be happening from now until October, and canvassing efforts in order to go ahead and really motivate the Latino and Hispanic community to go ahead and make the decision to get vaccinated. We'll be going through just some of the requirements for your events. We will also be sharing some tips and tricks on how to go ahead and really maximize your efforts with working with the community, and additional resources that we have available. I also have my colleague, Jennifer Reyes, who is our health programs coordinator, who will be also tag teaming the presentation with me. So without further ado, Jennifer, I don't know if you want to say a quick hello really quick.
Yeah, so hello, my name is Jennifer. I'm the one who's been emailing all of you guys. I'm the new health programs coordinator. I joined the team June 1st, so it's been like almost 2 months. And I'm very excited to work with all of you guys. Thank you so much, and I'll share the screen.
Perfect. Thank you so much, Jennifer. So today we will be covering quite a few items throughout this presentation. We will have a quick introduction of who we are, as well as our COVID-19 support and relief efforts. As you know, the last year and a half plus has been incredibly life-changing for so many people, and LULAC members really stepped up quickly to go ahead and provide relief. So we will be shedding some light on just some of the efforts that we've been able to do nationwide through our councils and partners. And then, of course, we will talk about the Vacunate initiative, what that encompasses, and the different phases. And then, of course, the opportunities, which is why you all are here, in terms of canvassing and pop-up vaccination opportunities, what kind of reporting we're looking for in terms of what you will be turning in to us to show impact and metrics, so that we can go ahead and also provide that information to some of our health partners. And then we will briefly go through COVID-19 FAQs, and then how to best engage with communities and how to develop an action plan. And then, of course, internal LULAC resources such as the hotline that we are launching, and our lift opportunity for those that may have a transportation barrier to be able to make it to a vaccination appointment. And then, of course, best practices on social media and communication assets. Again, we will be emailing this presentation out to everyone who has signed up for one of these events and has been contacted by our staff. So please, if you have members of your council, that were not able to make the training, please let me know, and we can go ahead and schedule additional time if there's any questions. We will be taking questions at the end of the presentation that you may have, and then we will be making additional announcements. I see a comment on the chat. Can everybody hear me, or is that just isolated? Okay.
Yeah, I can hear you.
Okay.
I can hear you.
Martha, you might want to raise your volume if you still cannot hear me.
I can hear you. This is
Okay.
Miss Montemayor from LULAC 7.
Okay, perfect. Awesome. So next slide, Jennifer. Perfect. So the League of United Latin American Citizens is the nation's oldest and largest civil rights volunteer-based organization that empowers Hispanic Americans to build strong communities. Again, we are headquartered in Washington, D.C. We have over 400 LULAC councils around the United States and Puerto Rico. Our program services and our programs, services, and advocacy efforts address the most important issues for Latinos to meet the critical needs of today and the future. Next slide. The LULAC Programs Department really is that link between our mission at the national office and working through our councils and partners in communities to bring services and awareness campaigns to communities in need. I know I've worked with so many of you in the past. I see some new faces, and I'm just really, really excited to get to know you all a little bit more through these efforts. Again, our organization really is because of you guys, the way that you guys mobilize in your community, the way that you guys give us that direct feedback of what you're hearing. And I think that that is what makes this organization so special. There is strength in numbers, and I cannot wait to, really see what you guys are going to be doing in terms of some of these vaccination efforts and the education that is so needed. I'm Sandra Carabel, Programs Manager. My colleague Melissa Cosillo is Workforce and Community Programs Manager based in El Paso. Priscilla Garcia is the Technology and Empowerment Program Coordinator, who is also based in El Paso. And we have Jennifer, who is joining us today, who is our Health Programs Coordinator, who is in Washington, D.C. We do have our contact information there. If there is any interest outside of these COVID-19 vaccination efforts to learn a little bit more about our LULAC programs, please feel free to reach out to us. We're always looking for new partners. We're really excited to work with all councils across the country. I know we have different pillars from education to technology to immigration, health programming. There's always a good fit. There's always a project that would be a good fit for our council. So we're always happy to explore more of those efforts with you. Next slide. So COVID-19, as these rates started to ramp up, March of 2020, LULAC quickly mobilized to go ahead and come up with an action plan on trying to get as much information out into the community. What we found was that there was limited information and resources that were available in Spanish. Along with just being able to pull a lot of the resources that were being offered by some of our partners and by our LULAC members. We also decided to address a lot of these issues and bring information to communities in English and in Spanish, which really spurred our Ayuda en Español effort. So that is a landmark campaign to really bring awareness and education on how to stay healthy, how to combat COVID-19 and stop the spread through working with our LULAC councils and partners across the country in Puerto Rico. This really started as a multi-tiered event that really started with marketing and media campaigns and radio PSAs, all the way up to direct relief that was done through our national office and through our LULAC councils. So through our efforts, we reached over 47,000 individuals in direct assistance with the help of more than 130 councils. These efforts really included everything from food drives to PPE distribution, rental assistance, mental health services, helping support access to the internet, getting equipment to families in need who may not have had a laptop or a tablet, as many transitioned to be working and going to school from home remotely. And then, of course, we did support these efforts as well by providing toolkits and educational resources in English and Spanish that were published to go ahead and support not only health education, but we also provided information on social services, how to apply for benefits, how to stay healthy, how to, best practices for going to school and working remotely, how to stay connected through this time, and so much more. And through our marketing campaign, we actually reached more than 8 million recipients through our communications campaign that really, shed light on this through PSAs, banner ads on the internet, targeted social media, and so on and so forth. Next slide. Then this is a quick video of our efforts. I think, Jennifer, you need to unmute yourself.
Oh, sorry.
Touch the lives of millions of Latinos in very real ways. It was spring 2020, and something new called the coronavirus was beginning its deadly sweep across America. Infections were starting to spread. Fear was growing, the economy was shutting down, and furloughs were rampant. People had many questions, and LULAC saw there were few answers and even less in Spanish. That's when Team LULAC stepped up and created in record speed Ayuda en Español, one of the nation's first Spanish language one-stop information resource and referral platforms, social services, health updates, technology, and up-to-date educational tools all in one location. An easy-to-navigate site with explainers on COVID-19 and its impact on multi-generational Latino households, including those at highest risk, the chronically sick and seniors. Then LULAC achieved another significant milestone, a multi-platform media and communications campaign that broke new ground. For the first time, COVID-19 messaging was centered around culturally familiar images, words, and phrases. The results? More than 250,000 impressions using an array of platforms, including Spotify, Pandora, and local radio stations. Also, YouTube and video streaming platform homepages across the United States and Puerto Rico. They were joined by celebrities including Eva Longoria, Danny Trejo, journalist Mariana Atencio, LAFC MLS Soccer Club. Ayuda en Español turned adversity into an opportunity for LULAC to face and overcome the challenge.
Awesome. Thank you so much for that, Jennifer. And these were some of the graphics that were used through many of these platforms, through our social media pages, to really promote our LULAC.org COVID-19 homepage, as well as our Ayuda en Español homepage as well. So building off of that success, next slide, through our vaccination stage now, we knew that we had to stay mobilized. We knew that we had to also make sure that the Hispanic community was being educated on the benefits of vaccination rates. This is really our shot to be able to go ahead and curb this pandemic and try to go ahead and go back to normal as much as we can. Our team was able to get together and really brainstorm out Vacunate Hoy, which is a landmark bilingual campaign really aimed at educating the Latino community on the benefits of vaccinations, debunking misinformation and disinformation, really talking about the scientific research and support on the development of these vaccines. Of course, this was a very fluid situation in terms of the way that we have been able to access vaccines, from the messaging to combating hesitancy. We've gone through a lot of changes in just the last 6-7 months on the vaccination efforts. Nonetheless, we know that our part is really having to educate the community and really do more than that in terms of being able to bring pop-up clinics, being able to go ahead and canvass neighborhoods and bring these resources directly to those neighborhoods in need instead of them coming to us. So phase one really was the kickoff out of vacunatehoy.org. This is really a one-stop shop webpage. It's in English and Spanish that really has all the information that housed there in terms of state, local, federal resources, an interactive map that allows you to be able to look up your local vaccination site that's closest to you. We have FAQs, we have questions answered regarding vaccines, the development, what our partners are doing. We also have toolkits that are available, as well as PSA videos and social media assets for the community and public's use. Phase two was a sub-campaign within Vacunate Hoy geared towards essential workers. We nicknamed this one Yo Me Apunto. What we were listening from the communities across the country were that those that did not have the luxury of being able to work from home, that were traveling back and forth on a daily basis to complete their jobs, did not have the proper information to go ahead and get that vaccination. They were hesitant. They are did not know where to access the closest vaccination site to them. So this was something that was very important to us to be able to go ahead and bring that resource to essential workers. Now, July 2021, phase 3 is really our Vacunate hoy initiative. As we start expanding out to general markets, we are enlisting the help of our LULAC councils and partners to donate time and efforts to inform their local community about the benefits of getting vaccinated, assist with on-site vaccination efforts, help canvass communities, especially those with the lowest vaccination rates across the country, and then of course share LULAC resources to aid and debunk misinformation that is circulating, and really trying to address the fears of the community so that we can go ahead and, raise the rates of vaccination and really try to go ahead and stomp out this pandemic. Next slide. So we do have 2 opportunities that are available. I know some councils signed up for one, others signed up for another, some signed up for both. So with that being said, the first opportunity that I'm going to go ahead and touch on is the canvassing. So canvassing requirements is really having our LULAC councils and members go into communities door to door, drop off information, hold quality conversations regarding any questions that some that are hesitant to receive the vaccine that they may have. We also want to make sure that we're able to go ahead and drive traffic to our Vacunate hoy page or help walk through some of these folks that may want to look up their closest vaccination site. What we're asking for is LULAC councils to identify neighborhoods hardest hit by the pandemic in an effort to go ahead and increase education and awareness about COVID-19 vaccines. Our goal for every canvassing event is to have our LULAC councils disseminate 1,500 pamphlets of information. Additionally, and we'll talk about the council boxes that we will be sending out to everyone who has signed up in a little bit, but additionally, this is also an opportunity to share information regarding LULAC, what we do, who we are, as well as some of the other program initiatives. We do have several programs that are geared towards health. A lot of the inequities that we have seen were present before COVID-19. They were items that we were working on, such as obesity, diabetes, clinical research, HIV testing, and stigma. Those are all incredibly relevant topics as well. Then we will be sharing some of that information to our LULAC councils that are participating in canvassing events as well, to be able to disseminate within the communities that they are canvassing in. We will be providing $500 stipends for the canvassing of efforts. A reminder, LULAC will be providing all printed materials as long as there is availability for you all to use. Stipends can be utilized to aid any supplemental printing materials that you may need for any PPE that you may need as well for volunteers, and for any other canvassing efforts, paid social media, transportation costs. If there's any, you can give a stipend, and you can utilize your stipend in that way. All events must take place between August 1st through October 15th. Our goal is to close out all of these reports by October 31st. We will be getting into the reporting requirements a little bit later on in the presentation. I've been approached by several councils that want to do multiple efforts and events. That is fine, but we do want to go ahead and extend the opportunity to each and every LULAC council. So right now we are limiting this to at least 3 rounds of canvassing, and you will have to fill out 1 report for every event that you do. Pop-up vaccination events. This is a little bit more detailed and requires a little bit more planning in terms of what we're aiming to go ahead and achieve here. We are looking to go ahead and bring vaccinations to populations in need, especially those that face multiple barriers, such as not knowing that insurance is not required, having transportation barriers, those that may not have somebody that speaks Spanish at their local pharmacy. This is who we're really trying to service, those that may not not have ample time to go ahead and get vaccinated throughout the week or only have time on the weekend. I know that we've been looking at some of the submissions from the LULAC councils, and I see that there's multiple events at multiple hours. So really excited that you guys are being thoughtful about what is best for your community. LULAC councils, of course, we are a trusted name. We are looked at as a trusted organization. You guys play an important role in being able to gain the trust in communities that you live and serve in. So what we are asking is for LULAC councils to either partner with local health affiliates to host a pop-up clinic to vaccinate your community and bring awareness to COVID-19 prevention. And then, of course, tabling it to be able to disseminate information regarding misinformation, answering questions that anybody in the community may have, addressing vaccine hesitancy, especially in the Spanish-speaking community. I do want to go ahead and flag and make the announcement that if you have not identified a health partner yet, such as the Department of Health in Texas, for example, or a local clinic, we are happy to go ahead and help you find a health partner. We do have some national partnerships through Walgreens. We will be getting a listing. This is why we asked for as much information as possible when we asked about your event, because if you did not identify a health partner, we're willing to go ahead and work with you to go ahead and bring that resource to your community. Additionally, we do have the opportunity to go ahead. I think you need to go back one more slide, Jennifer. Sorry. No, you're going forward. There we go. And then, of course, we have had certain events that we have been testing out in the community where it has more of a health feria feel, health fair. We do invite local stakeholders, such as the health departments, your local politicians, council members, local government officials are always, helpful in driving a lot of traffic to these events. Pharmacies that are willing to donate anytime, as well as vaccines, that is always welcomed as well. Hosting in a church or community center is always important. Again, I would like to stress, and this is something that we will be sending in the PDF council guide. You will get a hard copy and a digital copy of this, but I do want to go ahead and stress that all of these events, especially the pop-up clinics, we do have our COVID-19 guidelines that we want to emphasize. You will be working with folks that are either newly vaccinated or have not been vaccinated. So please, keep in mind that we do need to observe social distancing guidelines. Everyone must wear a mask regardless of whether or not you are vaccinated, just to really promote good habits at some of these events as well. Next slide. The council box. So our team is putting together boxes that will contain all of the supplies that you will need for your events. They will be mailed USPS, and what we will be including in there is a double-sided Vacunate hoy flyer in English and Spanish. We will have a dedicated flyer for the All of Us research program. That is a program that is run by the National Institutes of Health that promotes clinical research and precision medicine. What they want to do in that goal is really enroll 1 million people in 10 years to go ahead and be able to really show the diversity in America, to have the inclusion of different races and ethnicities in clinical research. And I think it's incredibly relevant as we see the development of vaccines, really looking at the research behind it. This is so important for us. And I think that it's a very timely program for folks to learn a little bit more about this. There are target cities where we are planning to have a bus also come out and kind of have that hands-on experience. I will be reaching out to some of our councils that have signed up for some pop-up events where there is some overlap with the MEA module bus. And then, of course, we will include materials for the Let's Stop HIV Together campaign. This is a campaign that LULAC works with the Centers for Disease Control to really promote HIV testing among the Latino community, as well as fight stigma that is attached to HIV/AIDS. So we will be sending out some information in English and Spanish there. And we also have our AT&T low-cost internet program, as long as folks are receiving SNAP benefits or come from what is considered a low-income house. We can go ahead and share the information for people to apply for an internet service that will cost $10 a month. And then we will be inserting giveaways, freebies, whether it's hand sanitizers to pens to bags, as long as, there's, depending on availability, we will go ahead and insert some of those items in your box. You will also receive a physical copy of the council guide. That's going to cover a lot of what we are talking about today, some of the best practices. We will have templates for you as well for press releases, for social media, graphics that you can use, how a script for you to be able to use when you go canvassing in communities, as well as lift codes and some of the other items that we are covering throughout this presentation. And then we will be sending posters as well. We will have a media release poster that you can go ahead and utilize at pop-up events or any other events that you may be hosting in a set location. This really just covers us to be able to, for you to be able to share photos and videos with the national office, as we'll be utilizing this on social media and sharing this with our partners. We also have a short survey for community members to fill out. And this really addresses the vaccine hesitancy, really asking people, have they been vaccinated? What is holding them back? If anything, what are their plans if they have not been vaccinated, in terms of time frame when they feel more comfortable to get a vaccine? We will be asking for those items back to be turned into the national office as well, to use for our own internal reporting and research as well. We are also providing, member interest cards. I know we've gotten a lot of feedback from LULAC councils in terms of trying to have recruitment items. We will be asking questions in the final report, how many people that you have impacted, but those are going to be for you to be able to keep, but we will be asking for that number of folks that you have engaged with in terms of possible potential membership outreach. Boxes will be shipped out via USPS through the post office. Again, if there are any changes to your event date, please let our office know as soon as possible to avoid delays or avoid us to be able to go ahead and we're trying to be cost efficient in terms of FedExing or UPSing anything overnight. So please let us know. I know I've had a couple of flags already where, there was an original date and it got moved up. So as soon as you guys find out, just reach out to myself or to Jennifer, and we're happy to go ahead and work with you. Next slide. The final report, just as you all signed up through a Google form, we will be sending another Google form out that will consist of the final report. We will be providing all templates for your approved work plan once your council has been accepted. I know Jennifer has started making efforts in communication to go ahead and finalize your events. We will be following up with a final link for these reports. This will consist of a recap of the community surveys. Whoever was the point of contact will give us a rundown of the event itself. So any recap, relevant details, where, when, how many people were impacted, photos of events, how many people you engaged with, any social media metrics and screenshots are always welcome. Testimonials are always highly encouraged. I think that this really gives us a real view of what's going on in your community. What are the benefits of getting vaccinated? What are the hesitancies? This really also helps us in our own strategy on how we need to pivot as these vaccination efforts continue to unwind throughout the year. And then, of course, reports are due no later than 2 weeks after the event was executed. One, we do this so that you guys don't forget. And two, the information is still fresh, that you're not piecing everything together at the last minute. And then, of course, we have events that run from August 1st to October 15th. And then, of course, our goal is to close everything out by October 31st. Yes, we will be talking a little bit more about social media, Anaí, as the presentation goes on. Awesome. So I'm going to go ahead and turn it over to Jennifer to run through just some of the COVID-19 FAQs. Again, we will be all of this information will be included in your council guide as well. And then you will be receiving a copy of this presentation.
Thank you so much. Okay, so when you're engaging with community members, they may still have these questions like, what is COVID-19? Other than we're in a pandemic, like more specifically, it is known as, it is a disease caused by SARS-CoV-2 virus. Sorry. Severe acute respiratory syndrome, coronavirus 2 refers to the virus, while COVID-19 refers to the disease. So the COVID-19, the disease, is caused by the virus SARS-CoV-2. Just more technical terms. And how is COVID-19 spread? We've been seeing that it is a respiratory thing. So that's why it is so important to wear a mask and social distance. And that's why we're encouraging you to not only do that when you're doing your canvassing events and your pop-up clinics, but also like letting the public know this information that while the CDC said you no longer had to wear your mask, and now they're bringing it back that you do have to wear a mask, just like keeping it consistent that we should all be wearing a mask, especially now that the Delta virus, the Delta variant, is the main spreader in the United States now. So what are the symptoms of COVID-19? Maybe some people may ask you that. So these will appear 2 to 14 days after the exposure. These symptoms may include a fever, chill, cough, shortness of breath, and the list goes on. There's many symptoms. These were just a few that I listed. You can find more on the CDC website or vacunatehoy.org website. There we have a whole fact sheet toolkit with all the information that you may, I apologize, that you may need. Next. Okay, and then you'll definitely get a lot of questions about the vaccine. Many people are hesitant about the vaccine because they don't have enough information, or the information that they do have maybe was misleading or just not correct. So why get vaccinated? The vaccinations against COVID-19 will help prevent you from contracting the disease, but also just helps you protect, gain immunity to COVID-19 so that when you do get it, or if you do get it, that it doesn't hit you as severe as it could potentially. How does the vaccine work? So this is more the technical explanation, but the COVID-19 vaccine helps your body develop immunity to the virus that causes COVID-19 without us getting the illness. So getting the vaccine does not give you COVID, but it helps you get protected for when you do get it. And there's different types of vaccines and they all work differently, but they all protect you at the end of the day. And sorry, it says the body is left with a supply of a memory T lymphocyte. But basically it injects you with like with
antibodies.
Yeah, sorry. I was like, I can't tell if my computer or like my internet ran out. Sorry. The antibodies to help, keep you protected. And there are 3 types of vaccines. There's the Pfizer, which is 2 doses, and you get that 20 days apart, and it's 95% effective. Then you have the Moderna, which is also 2 doses, but that one's 20 days apart. And that one is 94% effective. And then there's Johnson & Johnson, which is the 1 dose, which is 85% effective in protecting against severe infections. So if the person gets Pfizer, they must get their 2nd dose Pfizer. And then with Moderna, same thing. 1st dose Moderna, it has to be 2nd dose Moderna. And then I need more than 1 shot. So if they got Pfizer or Moderna, yes, they'll need their 2nd shot for it to be the most effective. While if it's Johnson & Johnson, they will only need that 1 dose. Or if you have questions about if they need to get a booster shot, then that's another thing too. They are recommending that within a year or so, like after you got your 1st dose or your last dose, that you would probably need to get another one. And then in continuation of these questions is who can get the vaccine? Everyone 12 years old and older in the US is eligible for the COVID-19 vaccine, regardless of their immigration status. That may be a fear that some community members might have, whether they have a mistrust in the government or the healthcare system, but just letting them know that it is free and it is for everyone, and to take advantage of the opportunity. And it is safe if you have no underlying medical conditions, or if you're not allergic to any of the ingredients. Can I get the COVID vaccine if I had COVID-19? Yes, you can get the COVID-19 vaccine if you've already had COVID. Experts don't know how long these antibodies last when you get COVID, so it's always, for precautionary reasons, the best idea is to get the vaccine. Can I get the vaccine if I'm currently sick with COVID-19? The answer to that would be no. If you're experiencing symptoms, it's best to recover. And then once your doctor says that it is okay for you to get the vaccine, then that would be the best time to start seeking a clinic or a pharmacy that would provide that for you. And then where can I get the vaccine? So you can find more information about where to get the vaccine in various states on our vacunate.org website. There you can just find like a list of different locations that are offering free vaccination clinics in your community. Or if you're doing canvassing events, if you're doing a pop-up clinic, then you can let them know of an opportunity within your own community for them to get vaccinated. Next. And then responding to vaccine hesitancy. So what is vaccine hesitancy? It is defined as a delay in acceptance or refusal of vaccines despite availability of vaccination services. So many people are hesitant to get the vaccine, mostly because of the disinformation, misinformation that's circulating around. So people are genuinely just scared to get it. And then why are Latinos hesitant? It is because they're concerned about the vaccine safety. Like, why was it developed so quickly? And they're also scared of the side effects that may come with it, but then also just letting them know that, it's better to have, the vaccine and get some of the side effects than to actually get, sick with COVID-19. So like it's better to protect yourself for the future, because you never know. And then how can we combat vaccine hesitancy, it's always important to have these conversations to let them know that it is important to protect yourself, but also your community. We can't get out of the pandemic, or, we can't get back to normal, whatever that may be, if everyone isn't vaccinated. So it's kind of just like pushing that confidence in the vaccine that it does work, and that it will protect you. So when talking to communities, it is important to be empathetic and understanding. Again, there's a lot of misinformation. So a lot of these people are scared to get the vaccine. So it's like, don't approach it from a place of judgment, because then they're going to be hesitant to get it. And then don't sound condescending. Don't like look down upon them for whatever reasons they may have. Don't pick a fight with anyone. Have quality conversations and just better understand them. Share your story. Like if you got the vaccine, letting them know why you got it, whether it was for yourself, for your family, to protect your community, to go traveling, to see a family abroad. And then just being honest about the side effects that you experienced, which most of the time it's 1 or 2 days, but then you feel fine. But again, it's just being honest with them about your experience with the vaccine. And then just communicating with them the benefits of getting vaccinated. Don't focus just on the science alone. Like, again, focus on the emotional aspect of it. Again, it's a community effort. It's better to have everyone vaccinated so that, again, we can move forward from the pandemic. And then the script will be included in the council guide for reference, for more talking points, and just a more detailed, explanation of what you can say to community members if they do ask these questions, and how to approach it. So how to canvass. So what is canvassing? It's gathering information and knowing your community, and identifying that audience and developing your message. So it's not just handing out flyers, it's really engaging in these conversations, getting to know your community members, like, why are you hesitant? And again, providing them that information, being that source of trust for them, to relay that information. Again, you should know your community. So if you're going in a community where it's predominantly Spanish speaking, making sure you have volunteers on the ground that speak Spanish that can relay this message to them in a language they understand, and are receptive to. And just create a plan, like, what in your community, what do you want to focus on, and who do you want to partner with, and what zip code do you want to hit? Like, if you know that a specific zip code, not many people in there or that community have gotten vaccinated, making sure you prioritize, or prioritize that neighborhood, and make sure you're spreading the information and educating your community members about why it's important. And if I'm missing anything, Sandra, please jump in. And then the pop-up event clinics, it's engaging your audience, handing out information, working with either a local politician or a local pharmacy. When my mutual aid in my community, when we did a pop-up clinic, we did ours at a church. We did ours at an apartment complex. It's basically like, we want to be as accessible to these communities that don't have access to this stuff. A lot of the communities we hit were undocumented, so it was really like we were trying to be as accessible to them, making sure that they knew that you didn't need to show your documentation status, and then also having Spanish and English consent forms. because the partnership that we had with Safeway, they wanted physical copies. So making sure we had Spanish and English forms for these families. And a lot of these families didn't know how to read or write. So it was having, Spanish speaking volunteers on the ground, filling out these forms with them, taking the time, to adhere to their specific needs.
Thank you so much for that, Jennifer. And of course, I know she quickly went through those FAQs. We do have a lot more information that will be included in those copies of the council guide, scenarios, tips and tricks on engaging the community. I think she hit it spot on that what we are seeing, especially in the immigrant community, in the Hispanic community, is that there is a lot of misinformation circulating that you need to be insured to get a vaccine. You need to have legal status. Again, I would really focus on that. Those are not needed. Being able to give that direct answer to the community members on the spot is so important. What we are looking for are conversion rates. What we have also seen that works is creating those multiple touch points, which is why canvassing is so important as well. I would also really think about those councils that are hosting pop-up clinics and doing the canvassing efforts to really think about maybe a 3 to 5 mile radius that you want to cover that is close to the pop-up event, because I think it's going to be effective when you start canvassing a week or two prior to these events, putting the word out there, creating those multiple touch points. It's so incredibly important for them to recognize and kind of put those pieces together so that the day of the event, you get that traffic that's coming through. You might not get them there, but at least you're able to go ahead and answer some of those questions, be able to get that comfort level, and hopefully have that conversion rate of somebody being able to say, I'm here to get vaccinated and I'm ready. So moving on, the opportunities that we also have here, really internally, we have a partnership, a national partnership with Lyft. And this is really a resource, a really great resource for those that may be facing a transportation barrier, those that do not have access to a car, may have limited time in terms of public transportation. We have been in-kinded Lyft codes through our partner Lyft, and that's really for individuals to utilize and access transportation to their vaccine appointment. So we do have this as a twofold effort. One is a national campaign through our hotline, which I will be talking about next. We are also offering this code to the councils that said, yes, they were interested in receiving a Lyft code to be able to utilize. So if you happen to run into somebody in the community that you're talking to that says, hey, I have limited resources, I cannot make it to I cannot take multiple buses to get to a vaccination event. I think that is a good opportunity for us to be able to introduce Lyft codes for their use. So what we have is, for one person, we have a credit of $60 broken up into $30 increments, which really is a ride to and from what they're going to, where they're going and coming from. And then, of course, from there, if there is any difference, that would be charged to the individual that is utilizing the Lyft code. We do have detailed information on the council guide in terms of how to go ahead and insert that into a Lyft account, being able to put the code in so that you can go ahead and have that credit. We do have a cap on the codes, and they must be redeemed on a first come, first served basis. Throughout our internal conversations with Lyft, there are opportunities for us to keep expanding the partnership as the codes get used up. So if there is a gap, there may be a gap of 24 to 48 hours until we get the okay to keep expanding once we've exhausted the first phase. Those of you that signed up for the Lyft code in the intake form, Jennifer will be reaching out to be able to share those codes with you. If you did not sign up for the Lyft code, please reach out to us. We're happy to go ahead and accommodate. Again, just emphasizing that it doesn't serve the national office to keep these resources in-house. These resources are really for our LULAC councils to use to help the community as well. Next slide. So starting August 1st, LULAC will be launching 1877 Me LULAC to really cover all the COVID-19 related questions and needs that the community and our councils may have. This is an effort that's really geared towards folks that are not tech savvy, that may not have a smartphone, that are more comfortable picking up the phone and being able to speak with somebody on the line to address any questions. Again, what we are looking to service here is probably more senior citizen age that do not feel comfortable using the internet because they may not have access or because they do not have the right equipment to go ahead and navigate the internet. So this is really taking everything that is online and shifting it to a hotline. We have operators that we have trained to be able to answer questions regarding COVID-19, vaccination efforts, also what LULAC is doing, and really help people to go ahead and find the closest location to get vaccinated. And really make that appointment for an individual or a family that is eligible to get vaccinated. Additionally, those that may not have transportation, we have our national lift code that they can utilize. We can go ahead and book that lift transportation directly for an individual there as well. Thank you. Any additional informative resources that we do have our homepage, vacunatehoy.org. There we do have our council toolkit that is housed, and that really is focusing on vaccination information, misinformation, the development of vaccines, what is clinical research, and so on and so forth. We do have our LULAC at home page, which was the original COVID-19 webpage that houses all of our English resources. Additionally, we do have LULAC Ayuda en Español that houses all of our COVID-19 information and resources in Spanish. We do have our LULAC town halls. We've been lucky enough to have some of our partners, national and local, really have these town halls, these intimate conversations with the communities across the country to talk about vaccination events, efforts, developments, and really address a lot of the questions that the community may have. Additionally, we do have public service announcements that we will be sharing with you all for your own use as well. And then, of course, the Center for Disease Control, the COVID-19 homepage is really also, a trusted source to be able to address any additional questions and new guidance that we come up. Again, this is a very fluid situation. As we've seen in some states, we are already looking at going back to wearing a mask indoors. We may be seeing more mandates that may be coming out further later on in the year. So it feels that it's an ever-changing situation for everybody. Next slide. Communications. This is going to be essential for you to go ahead and have successful events in your community. We will be talking about traditional media as well as social media and talking about some samples and just best practices when it comes to communication efforts. So traditional media includes media advisories and press releases. Media advisories really serve as that initial notification to the press of an upcoming event so that they can prepare and really put this in their calendars if they're interested in attending, and checking out the event. Again, we will have a template of this in your council guide for you to use. We have made it very easy for you to just put in your council number, possibly put in that information of location, date, times, so on and so forth. It's fairly easy for you to go ahead and read through and insert your information. Again, if you have any questions or you want us to go ahead and review any items before you send out, our team is available to go ahead and help in any way that's needed. A press release is a little bit more formal. It's distributed to various media outlets, local outlets, after an event has taken place to inform the media of what has occurred. So media sources will then decide, is this newsworthy? Can we go cover this in publications? So here I would really suggest highlighting success stories, any statistics, any metrics to really emphasize the impact of the event and possibly include any future activities. again, producing newsworthy stories is always vital in really showing that impact and that positive goal that we are aiming for here. So I would say, you know, keep that in mind when you're choosing on what you might want to highlight about this, about these efforts. Working with the media, if any of you have any existing relationships with any of your local media, any national media, it's always great to go ahead and tap into them, you know, identify a reporter, follow up. Again, be mindful of deadlines. The news is changing so quickly. What was newsworthy at 8 o'clock may not be newsworthy at 5 o'clock. So I would be mindful of just what that looks like in terms of your contacts. And then, of course, always offer what you can provide. Do not overpromise. Do not tell lies. Please be truthful in your events, in your recaps. You know, again, we want to make sure that we keep the integrity of the organization, your local councils intact as well. So social media is always, you know, beneficial to our events. Creating and publishing social media ads and postings on channels can help increase awareness of your council and organization and the impactful work that you are doing. There's various social media tools that can help you facilitate outreach and marketing strategy as well. Many organizations already have social media pages to promote their event. I know that we did ask for any of your handles. That really helps us kind of monitor and make sure that we're aiding you guys through the national platform and resharing, retweeting, sharing on Instagram stories. This is why we did ask you guys for your handles as well, so that we can go ahead and aid you. If you do not have a social media account for your council, or you want to, or you choose to promote on your personal, again, you know, we do recommend that you guys push these events out, you know, share among your networks and really, you know, increase that traffic on your page as well, to showcase a lot of the great work that you guys are doing. Next slide. So the LULAC national handles, if you do not follow us already, we do have a Facebook, Twitter, and Instagram account. Those are handles that are attached to these accounts. If you don't follow us, I'm gonna make that plug, please follow us. The dedicated hashtags that we have right now are, of course, LULAC, LULAC programs, Yo Me Apunto, and Tu Salud Si Cuenta, and Vacunate Hoy. Sample social media, you will be getting a copy of a Google Drive that houses multiple images that you're able to use among all of the different platforms, Facebook, Twitter, Facebook, Twitter, Instagram, as well as some sample copy that we are providing. Again, if you'd like to develop your own, you know, we do encourage that as well, especially if you're giving the details of the events, any opportunities as you promote. You can also tailor and co-brand any of the digital assets that we are providing as well. And these are additional graphics that we have. We do have poster size. We also have flyer size if you need to print any additional items. That would be something that you can do as well. If you want to co-brand anything, we welcome that as well. We will be sharing the branding guidelines that we do have in the council guide as well, so that you can be aware of just how we use our logo, the do's and don'ts of wording, you know, anything that is LULAC related. We do have a couple of policies in place on what goes out with our shield. And then these are additional graphics that we do have as well. Again, we will be putting together a Google folder that you can access, download. These are also available on the Vacunate Hoy page as well. If you need immediate access as well, you know, they're at your disposal. And then as we wrap up, you know, we will be taking some questions, but this is a quick little recap of just some of the work that we've been able to do in the month of July. We have had a couple of clinics in Phoenix, Corpus Christi, Houston, Los Angeles, Albuquerque, New Mexico, where we have been able to go ahead and work with some of our national partners during a bus tour. So this is, kind of giving you guys a taste of what to look forward to. And again, we'll be taking some questions after the video, but thank you guys so much for everything that you guys are doing. Again, I'm so proud of the organization and just our membership. You guys are the backbone. And I am just amazed at how quickly you guys mobilized through a pandemic to provide resources, to provide everything that you guys have been able to do. And I have no doubt that Vacunate Hoy is going to be just as successful as some of our other initiatives. So again, I thank you guys so much for that. We will have a couple of more announcements after questions, because I know that we do have a second training in process as well. So I will be providing some more details for that.
The oldest and largest grassroots civil rights organization. When we started seeing COVID-19 rates ramp up, we knew we had to mobilize to go ahead and create an action plan on awareness and also bring direct services to communities in need. Now that we are in the vaccination wave, Walgreens approached us to be a national partner, to be able to tour with them throughout the United States and drive Latinos to get vaccinated. We're doing a multi-tiered program approach, being able to talk about the communication aspect, being able to provide information in English and Spanish, and now utilizing our councils to be able to be out canvassing communities, being at events like this at pop-up clinics, and being able to educate the community to get vaccinated.
No tenía la información porque mucha gente decía que cuando se la ponen, que se siente uno mal, y muchas cosas. Pero dije, yo no voy a creer, yo voy a hacerlo. Por mis hijos, por mi mamá, mi papá, mi esposo, por todo.
So one of the things we've been doing is really building out partnerships with trusted organizations in community and that are reflective of the individuals we are trying to reach. And so we wanted to make sure we had Latino voices. And so working with LULAC for us was a no-brainer. It's a trusted organization in the community that has reach and is committed to reaching out to individuals. And so it was been an honor for us to be able to build out this partnership because we've been aligned around the goals of going into community, building trust around the vaccine, educating people and providing information to let people know, please, come out, get the vaccine. It's no cost. We're not requiring ID. We're not turning people away. And so LULAC has such a voice in the community. So it's been great to partner.
Awesome. Thank you. Thank you so much. So now I will go ahead and open the floor up for any questions that you guys may have. Feel free to go ahead and put it in the chat, or if you want to unmute yourself, happy to go ahead and take some questions.
Hello.
Yes.
Hi, I'm Cecilia Garcia from Council 5311. You mentioned something about the survey. So this is for the people that are going to be vaccinated that we're going to be providing them, I guess, the link, if I'm not mistaken. Okay.
Yes.
And, okay, so then that's something that we send them like via text, or, how is that going to be handled?
So we have a twofold effort. We do have a Google survey that they can fill out. If it's easier, we can go ahead and have them access that through their phone. We also have a hard copy, English and Spanish on one side. However, we do need to have that sent back to us. So whatever is easier for anybody who is filling out the survey. We would like to get as many surveys as we can, just because this really helps us to be able to go ahead and just see what's happening on the ground, what the hesitancies are, if people are not getting vaccinated, why. Recently, what we've seen is 18 to 29 age groups seem to be lagging in vaccinations. Also, what we've seen in just some of the research that we've been able to pick up has been that people are scared of the side effects. They don't quite understand and don't want to go through that. So really, that helps us in being able to kind of form the strategy and kind of pivot how we need to go. Let's see a couple more. Okay. That's a good suggestion, Jasmine. We can certainly look into that. And then Anai, stipends given to councils hosting. So stipends are given to any council that has signed up for canvassing. It's a $500 stipend. For those that want to do a pop-up clinic, it's $1,500. For those that that submitted for both and we approved, the total would be $2,000. Now, when we sent you the electronic MOU, we did outline the commitment of what we're expecting and also what the payments would be. So because of installment number 1, we did want to go ahead and give as much money as we could. For those that are hosting pop-up clinics, your check will be $1,250. You get the remaining $250 once the report is turned in and you guys are considered closed out. For canvassing, we sent half the amount, $250. Once the report is submitted to us, we will go ahead and approve your report and send out the remaining funding, which is $250. That felt fair in terms of, because we are utilizing a lot of our own materials and providing you guys the flyers and just some of those items, so we will be providing the bulk of those items. And then Rosemary, any number goals for vaccinations and canvassing? So for canvassing, we are hoping to reach 75,000 people. And through our pop-up events, we are hoping to go ahead and reach 100 pop-up events. And our internal goal would be having 50 people get vaccinated, totaling 5,000. Again, this is one phase. This is not the end of what LULAC does in terms of vaccination efforts. Once this is over in October, we're regrouping. We're also seeing what the trends are. And from there, we will be probably coming up with a new phase of these items. So we certainly want to have a strong showing because we also want to be able to keep showing our partners that we're able to go ahead and pull through and really get to the Latino community and just communities in general that are hesitant about getting that vaccine. In regards to the hesitancy due to not retesting. Yes, so Valerie, this kind of leads me into the announcement for the next training. We actually have our partner Walgreens that will be bringing a pharmacist, a tech, and then as well as somebody who has worked in clinical trials. We want to go ahead and invite our LULAC councils to that listening session to learn a little bit more about like the scientific end of these vaccinations that are available to the community, as well as give you guys the opportunity to go ahead and ask the questions that you guys may be unsure of, things that are coming up in the conversations that you guys have had, and also some of the questions that you feel may come up when you guys are out there canvassing or holding your events. Additionally, we are putting infographics available. We are putting infographics together. We're hoping to have that done in time by the time that we start sending out those boxes. This is really geared towards just some of the scientific information behind the vaccine development. And then Eliseo. Community is spread out, that reaching out via phone to families at home. That is also a good strategy, Eliseo. Again, what we have done is, for example, we had RSVP links for all of the vaccination events that we did through the national office. Again, we got some RSVPs, but the walk up was something that worked for us. We've also seen in other communities that, calling and kind of having these spaces with reservations also work as well. I would say the strategy is up to you in terms of that, but if you can identify people that want to get the vaccine through your event, that would be ideal. Again, I don't know, I can't remember off the top of my head if you guys signed up for pop-up or canvassing, but we can certainly talk a little bit more strategy on a one-on-one if you'd like, Eliseo.
Thank you. We signed up for both.
Okay, perfect. Yeah, we can certainly talk about that, and work through this. And then there is not another training today. We will be, since this is recorded, we will be downloading this and sharing this to everybody who has signed up through our council intake form. And of course, making that available to folks that were not able to make it on the call, or if you need to review any part of the presentation, you can go ahead and do that self-guided. The only other pending presentation that we will have is once we lock down a date with Walgreens. I know that it will be within the first 2 weeks of August, where we will have our guest speakers join us to go ahead and talk through more in terms of research and the nuts and bolts of the vaccine. Drive-through events are eligible. Again, we can certainly look through what the work plan was that was submitted for your council. But I believe Jennifer would have reached out already if there was any questions or any need for clarification. Again, we have had plenty of drive-through events that have also happened kind of just in the testing phase of what we were looking for pop-up clinics. If you have somebody that can bring those mobile clinics in the space for you to accommodate that, by all means, we do encourage that drive-through. Awesome. So I know we're about 10 minutes over. Oh, did somebody else have a question? I think we had somebody that raised their hand, I think, on the chat.
Yeah, this is Jaime in Wisconsin.
Yes.
Can you hear me?
Yes.
So one strategy we've done for voter registration is do a petition, and I was taking a petition to mandate masks in schools, and the other one is to say ask, hey, do you want to spread the word? Because some don't want to be members, but they're willing to spread the word. So I have another petition, and then I'll send them information on how to tweet and send messaging. Is that allowed? Do you think? Any problem with that?
I would say that is okay in terms of the outreach help that you're getting, even if they're not necessarily partners. I think it's okay for you to go ahead and engage them in that way. Again, we are giving preloaded social media as well that you can utilize and we do have our toolkits that are available that you can utilize. That is approved LULAC language. If you have, social media copy that you are developing, I would say, let's review the one for the mask mandates, just to make sure that we can approve on our end if you're going to be attaching like the national platform name on there or tagging us on any of the social media.
Okay.
Awesome. And I think Patricia had a question as well. You're on mute, Patricia.
There, I'm unmuted now. I'm here. California, Santa Nela, small little rural community, and we're 30 miles away from Silicon Valley. Can you believe that? So in our rural area and for the whole county of the western part of Merced, the question I had is that in our location, we do have the school. We only have the school and a fire station. That's it. And the tiny little library that's maybe one classroom. And we are working in collaboration with those groups. So that's why I was asking about the drive-through. One, they drive through to prepare what needs to happen, but they'll actually be in the cafeteria. And some of the outreach was with our LULAC clubs in the area are going to be helping canvassing for to help us with that. And I just wanted to find out that we need to make sure that they got like they're covered. We got authorization from the parents to participate and have some of the of course, some of the members, which are some of their parents as well, involved. So we just want to know if there were any guidelines, because when I was looking at the notification for the training today, ours said 3 o'clock. So I'm like, I'm at 3, but I'm like, what happened? So I just want to make sure if you guys have any protocols set up for us to follow in reference to be working with our clubs in the event as well. And we have partnerships with everyone, as you saw our proposal.
Okay, so we do have our COVID-19 policy kind of reiterating that PPE must be provided, people must be covered. Again, you're dealing with unvaccinated or newly vaccinated folks, just being able to stay safe in that way. Utilizing any of the funding for any PPE, wipes, disposable masks, that's always something that you can utilize there. In terms of working with youth, we do have a participation template that we have for like education programs. I think we can go ahead and tailor it to these events as well, since you'll be tapping into just some of the youth, parents signing off. I think it's better to be safe than sorry. We don't want anybody to come back and say, my kid got up and left and went to an event and got COVID or something along the lines of that, heaven forbid, right? So, we'll certainly be able to supply that for you.
Okay, thank you. Gracias.
Yep. Awesome. Well, I don't see any additional questions. If you think of anything, please feel free to reach out to myself, to Jennifer. Our contact information is at the end of the presentation. The programs team in general, we're slide number 3 on the presentation in case you need to reach out to any of us regarding not only COVID-19 vaccination efforts, but if there's any interest in any additional programs. But other than that, we will be sending out a notification for the other training that we will be having through our partnership with Walgreens. And again, thank you guys so much for your time. Again, thank you guys for all the efforts and everything that you guys are doing in your community. We sincerely appreciate it. Again, you will see some of our faces possibly at some of your events as well. We may be popping up. And other than that, thank you guys so very much. I think we did we get one last question?
No, I just wanted to say something. I'm pretty sure everyone in this group submitted their MOUs, but if you haven't, please submit them as soon as you can. That was all that I wanted to add.
Absolutely. And because of that, just a quick flag, if you have not submitted your MOU, we do need to have that in as soon as possible. Our CFO will be on LULAC travel all of next week. So if you're, please send that in. If not, we don't want any further delays on your funding. Awesome. Perfect. Thank you guys so much. Have a great rest of your day, and we will be talking soon. Thank you.
Thank you.
Bye.